time now, and it's been quite the game changer for Lyme treatment, which typically will be, 2, 3, 4, 5 years or longer, using all the previously known antimicrobials and antibiotics. But this medicine has allowed us, with the protocol that I put together, to shrink that treatment down for the antimicrobials and the antibiotics to as little as about 7 to 9 months, depending upon the patient. Obviously, it can be longer depending upon complications, but this has been quite the game changer for this. So this medicine was discovered way back in the late 1800s. It was rediscovered around World War II to use for parasites, and then they discovered that you take that and you get nauseous. Well, that's in vomiting if you get enough of it. So that didn't work. So then they tried using it for tuberculosis, and it worked, but you still had the same nausea problem if you combined it with alcohol. And so some other things were used to treat it. So they finally gave up and decided, well, let's use this for treating alcoholics. And so then for about 70 years now, it's been used for alcohol treatment. So the alcoholics who drink this get nauseous. But it was, when it was rediscovered, that by Stanford University, of all places, that was after a grant from the San Francisco Lyme Association. I forget the exact name of their association, but they funded this study. They looked at 4,366 medicines. They're narrowed down to 101, then down to 20. And the surprise was the best medicine to go after Lyme was Disulfiram. Everyone had forgotten about its antimicrobial properties over the years. And so then the first physician that tried to use it was Dr. Liegner, who, when I told him about my use of this, running across problems and the medicines that I had used to help to prevent and rescue my patients, requested that I write a paper on this. And so I got together with Dr. Grout. And so tonight you're seeing some of the information that we put together and I presented to iLads. Anyone's welcome to stop into the clinic anytime and watch the presentation that I gave to iLads. It's usually running up in the front lobby. And so Dr. Liegner had initial success, and other physicians did too, but they all ran into trouble because of some of the effects from the disulfiram. Now, normally what'll happen with when it gets combined with alcohol, either intentionally or unintentionally, is you start seeing some of the problems here: the nausea, the vomiting, the palpitations, weakness, etc. So that's no fun. The concern is, why does it happen? Well, the alcohol really isn't so much the problem. It's that the alcohol gets broken down into acetaldehyde, and that causes the problem. Now, once acetaldehyde gets broken down into acetate, it's very safe. The problem is that the disulfiram inhibits this aldehyde dehydrogenase enzyme, and so it causes the buildup of the acetaldehyde, which then results in lots of the toxic effects. And so some of the people will see some of the more fatigue and more brain fog and the numbness and tingling paresthesias, tremors. The liver enzymes can go up, and then you start seeing some blood cell problems. So we always run CBC and metabolic panels every 3 weeks just to make sure that there's not problems. And since we've implemented the protections, that the abnormalities have all but disappeared for our patients. We still run them, but just in case, but we're rarely ever seeing anything anymore. So the question becomes, if this medicine is got so many problems, why do we use it? Well, like I indicated to begin with, we can cut the duration of treatment down to months instead of years of the antimicrobials, and we got a much better chance of getting a durable remission on this this medicine, because the medicine goes deeper than anything else. It goes through biofilms. It'll get deep into the nooks and crannies where antibiotics and antimicrobial herbs can't get to, regardless as to whether you take it orally or intravenously. So the disulfiram is very effective against Borrelia, which is Lyme, very effective against protozoa, including Babesia. It does have effect against Bartonella. It's not robust, but it does work. And when you combine this with other antimicrobials and antibiotics, which is what we always do, then we can get resolution on that as well. And there's some other pathogens, other protozoa like Toxoplasma, Mycoplasma, which is a stealth pathogen. Strep and Mycobacterium also get benefit. We're not sure about Francisella, but there's a good potential it might help out, just because Francisella love to hide inside a protozoa, so we can disrupt their home, then we might be able to use the other medicines to get better effect on them. And I have seen, and Dr. Liegner saw with his treatments, that whenever rifampin was in the regimen, that treatments failed. So you're not going to see rifampin typically in any treatment that I prescribe, or Dr. Dupre prescribes here. So, first, you do no harm. This is our job as physicians, to try to make the safest, most effective treatment. So I always use the medications that have got the least amount of problems and the least complications with them. So the patients have got a better experience with this. And when using the disulfiram, second thing is to make sure that we give the patient the advice in order to stay away from not just alcohol, but there's also other forms of things like sugar alcohol, such as xylitol that you find in dental products, and erythritol that commonly we'll find in foods like drinks, like vitamin water, mannitol, sorbitol, some sugar-free foods that you'll see will have these in there. So as with everything, you always want to read your labels and see what's in there. And if you run into trouble with the disulfiram, and this is what I had to do first, was to find out, how do I rescue patients? Because the other physicians that started using this, the pioneers, their treatment was just stop the disulfiram and hope and pray that their patients got better. Well, I don't take that philosophy. If I can try to prevent it, or I can help to rescue a patient, and better yet, if I can do both, then I'm going to do it. So the mitigating treatments would include things such as glutathione and NAD, melatonin, R-lipoic acid, not alpha lipoic acid, R-lipoic acid, CoQ10. Thing that those things all have in common is that those all support mitochondria. That's the little power plants within your cells that make energy, that help with detoxification. So we support them, and the problems get minimized. Should you get the disulfiram reaction, dihydroamycin helps to break down that acetaldehyde and help to rescue you out of there. Not surprisingly, commercially, that herb gets marketed as a hangover cure or prevention. So the first mitigating treatment was the glutathione that I just mentioned. And again, this is one of your best antioxidants, with melatonin being an even better one. The other one being R-lipoic acid, and you have to use R-lipoic and not alpha lipoic, because there's two different forms of lipoic acid, and one of the forms actually makes the disulfiram reaction worse, and the other one, the R form, improves patients. So this is one of the reasons it is key, and it again supports your mitochondria, helps protect your liver, protect your kidney, and even better yet, it helps to chelate out metals. One of the things that the metabolites of disulfiram can do is to chelate or capture some metals such as copper and nickel that end up getting deposited in nerves, and that aggravates the nerve problems that patients see with using disulfiram. So we can do multiple things with this one medicine here to help protect you and to help prevent problems both. NAD is a derivative of niacin, which is vitamin B3, and it works in conjunction with glutathione to help make energy for your cells. So the two of them together work in tandem to help generate ATP, which is a little energy currency that all of your cells use. I know there's a lot of technical information on here. This is because it was given to the physicians at the conference. I'm just trying to just give the easier version here. Melatonin. Now, melatonin is an awesome protection for your mitochondria. The reason being is that a couple of billion years ago, when mitochondria first came about, they were making melatonin, and they still do today. So it's you not only support the melatonin, you're helping to get better sleep at night. It's a awesome antioxidant. And when you have healthy mitochondria, you don't see cancer. So this is actually used as a cancer prevention as well as cancer treatment. But in high doses, it takes at least 20 milligrams to start having antioxidant effects. So typically I'll dose my patients at 40 to 60 milligrams at bedtime, and it's handled just fine. And some patients will use this during the daytime too, and they don't get sleepy unless they're in a dark, quiet room. So this is the reason why cancer doses are typically on this 60 milligrams 3 times a day. And again, it's very safe, and it doesn't affect other hormones, and it doesn't affect your ability to make melatonin. CoQ10 is integral to the construction of mitochondria. This is a key part of their ability to function. Dihydramycin we mentioned earlier. So I originally used this just as rescue, but then during the research that Dr. Grout and I did, Dr. Grout discovered that it also benefits mitochondria. So we put it in as prevention instead. And that way, when patients are doing the disulfiram treatment, if they get that accidental exposure because they forgot or something got mixed in or a label didn't get read, whatever kind of accidental exposure, you use some hand sanitizer and you inhaled it, that you've already got the medicine on board to help deal with it. So it usually, the reaction never happens at that point. You never notice it. Or if it does, it's super mild. You just take a little bit more and you're all good instead of being sick for hours. Again, this is an herb that's been used for thousands of years in traditional Chinese medicine, and it's a safe herb. Pyridoxal 5-phosphate is also indicated. It's the active form of vitamin B6. You do not use vitamin B6. You need the active form of vitamin B6 in order to make this work. And then when we're all done with treatment, then when we have to do neural repair, we can do things such as hyperbaric oxygen. We can do peptides and other treatments in order to get you there. And and ultimately at the end, we're not only going to have to treat the Lyme, but also the co-infections. So there's lots of antimicrobials that we use for those, as well as antibiotics. But the antibiotics we'll use are going to be minimal. Typically doxycycline or minocycline gets used, or either that or clarithromycin or azithromycin, depending upon the patient. And some patients will use metronidazole or tinidazole. That's the older medicine that was primarily used, but don't use it too much anymore. Nitazoxanide, also known as Alinea, will get used, but this is more for the co-infections and some other issues. the herbs we'll use will typically be things such as Japanese knotweed in combination with cryptolepis, which Johns Hopkins University of all places figured out that it goes after the round body or cystic form, or what they renamed it as the persister form of Lyme. And so we'd not like to use that because it helps to go after the Bartonella, and the cryptolepis has additional coverage for the babesia. The got it. And again, other herbs, petunia, Dan Shen, Pau d'Arco, juniper, coptis, scutellaria, allicin, cistus, bayberry. There's lots of other ones that we use as well, and many therapies that we use in our practice. But we don't mandate that patients have to use them, but we have them available, and sometimes we'll need to use those before getting going on treatment. Things that can be IV nutrients, sometimes chelation, ozone, NAD treatments, EGCG if there's active viruses that are going on, acupuncture, and again, lots of other treatments. And we've got a lot of other referrals too that we can use. But there's a wide variety of ways that you can go about treating the infections, and it's all individualized for the patient. And at that point, I think I'm going to open this up for questions. Let me see if I can change the screen here. And here we go. Hopefully you can see me now.
Yeah, Doc, you're good.
All right. And so any questions at this point? We'll open the floor. Just
Okay.
One at a time.
So in the chat right now, I see somebody's asking if Disulfiram is okay for the use in children.
So have I used this in children? Yes, it's going to be used with much greater caution in the children. But yes, I have used it successfully. It requires a lot of adjustment with the medications, because we have to use glycerites instead of tinctures for the herbal medicines wherever possible. Sometimes it's not, so they'll have to use capsules and then mix it in with food. Or azithromycin, which is not as effective for any of these infections, but it's still helpful. And again, the kids are no different than the adults. They need the mitochondrial protections, but that's been pioneered. We've done that.
Thanks, Doc. Any more questions?
I had a question here earlier. How do you tell the difference between a Herx and the side effects with this? So typically, if you're going to have an adverse reaction to any medication, it's going to happen within 5, 10, 15 minutes. It's going to be pretty quick. A Herx reaction, or Jarisch-Herxheimer reaction, as it's formally known as, it was named after Europeans that aren't around anymore. Eventually it'll be after dead Americans, but Europeans get credit for everything. So a Herx reaction is a die-off reaction. And this is when this happens, then the pathogens aren't slowly leaking out toxins causing inflammation and pain, but you now blew them up. They're going to be dumping large amounts of toxins into the tissues. And so this is going to happen hours or days later. It's not going to be right away. If we were killing off pathogens that replicate quickly, like most of the ones in the gut, then we would get a much quicker reaction. But all these vector-borne pathogens, they take days, or in the case of Borrelia, it takes 4 weeks for one to divide into 2. So, and these antibiotics and most of the antimicrobials are interfering with that replication, and that's how they kill off the pathogens. So you're only going to have a slow amount of die-off at any one time, not like with penicillins or cephalosporins. And we don't use those typically because they don't get inside of the cells where the pathogens hide, they do that because that's how they became successful over millennia to evade the immune system. So again, for the kids, it's going to be dose dependent. I calculate that out by weight, and we adjust accordingly, up or down from there, depending upon the condition of the individual, just the same as I do for adults. There's another question here about aggressively treating Bartonella with Disulfiram. So again, Disulfiram will work, but you have to combine it with others. So typically there's going to be, for an adult, you'll have the doxycycline or minocycline, and then there's going to be herbs that are effective against Bartonella that'll get used. So again, typically the Japanese knotweed, Cryptolepis, Petunia, Danshen, Pau d'Arco, these are some of the more common herbs that get used. And it depends upon the individual as far as to which ones get selected and what's going to be most appropriate, because there's different co-infections that come in. There's rarely do you ever see Lyme all by itself. It's usually a cocktail. You got to look at the cocktail. All right.
All right, we have one in for the text, the chat. It says, do you feel IGeneX is the best place to test for Lyme?
So IGeneX is an excellent place to test. They're they've maximized the ELISA testing and other associated testing much better than the local labs have. The local labs are about the worst sensitivity that there is, and even so with these better labs, that the sensitivity is still nowhere near what we need. So the labs out there, you're looking at anywhere from sensitivities in the 50s, 60s, 70th, maybe even 80th percentiles. Some of the labs will claim, but they're nowhere near getting into the 90s, where you get back a negative lab and you can be confident that that's an accurate, appropriate finding for that. Pathogens, again, they hide from the immune system. They don't float around in the bloodstream, so therefore the immune system isn't seeing them. It's not making antibodies, and if the antibodies aren't there, then it doesn't matter how sensitive the test is, that you're not going to see the infection. So I'll use IGeneX on occasion. They're very expensive. Some insurances will cover, but they don't. Again, their patient's going to be left with a pretty hefty bill. And I'll use other labs, including DNA Connections and Vibrant America, and there's some other labs that are MDL that are, again, they're decent labs, and I have no preference for any of them. The one lab for Lyme itself,
your hands don't get tired.
most sensitive in the is R&D labs out of Belgium. They're expensive to ship to, but they are at this point the most sensitive lab just for Lyme. But like I said, you have to look at the co-infections.
All right, perfect. We have another question. Do you find that patients react more to alcohols in food or topical products as well?
When patients are on the dihydramycin, they rarely ever see reactions. If they accidentally have some fermented foods, it would be dose dependent upon, if they had some kombucha or kimchi or kefir or kombucha or sauerkraut, something was fermented. Most patients don't have any reactions because of the dihydramycin, and any alcohols that are found in creams and lotions, they never see any problems with it. And even when they're using the hand sanitizer, unless they're silly and put their hands up next to their face afterwards and breathe in the alcohol, they're not seeing issues with that. So because of that, the fear of accidentally running into alcohol has pretty much been taken out of the equation for patients to use this, and they don't have to live in fear that they're going to touch something or inhale something or apply something that's going to set them off.
All right, perfect. Next question, and just everybody, we have 4 minutes left. So a question came in, is it important to treat mold first?
Okay, so whether it's mold, whether it's heavy metals or any other toxins, it's going to be dependent upon the levels that are there. If the patient's unable to function at all because of the mold toxicity, then just doing the depuration and detox in order to offload the toxins would be probably first best thing to do. Same thing if I have heavy metals that are through the roof, then we probably ought to offload that first. Most of the time we can do the two things together. This next question, where's the best lab for Bartonella? Don't have a great answer to that. There's actually several labs out there that specialize in looking for multiple different variants of it. Most commonly I'll just use Vibrant because it's the most economical for my patients, and typically we'll pick it up. But there's other labs, including IGeneX and some others, that will do a deeper dive into other strains for it. And so what do I suggest for provocation for a child who can't do deep pressure massage? For them, you may just have to do the antibody testing in order to do this. Let's see here. Patient received IGeneX labs back for their daughter who was positive for Lyme, and best place to start is to get in with a Lyme literate physician. So you can go to iLads and they'll give you a list of physicians here in Arizona and in other states and other countries that are member physicians. Obviously I'll say, well, come see me, but really, you want to get in with someone who knows their business. There's a lot of physicians around that say that they treat Lyme and they've got no formal training and not much experience. They'll see a patient here and there, and there's other boutiques that are around here that I'll go nameless that charge a fortune and never get their patients better that we've seen.
All right, so we are nearing the end of our webinar. So I just want to let everybody know, one, thank you for joining us. We really appreciate it. I know that there are a lot of questions. Our last question was, what I saw was, do you do virtual appointments? So I do want everybody to know that we are opening up telemedicine. We have developed a really good process in phasing for Dr. Mitchell's program. So that is something that is new, and we will be doing that. So if you guys know anybody that just wants to get tested across the country to see if they have it, they can't figure out, where to go, they can contact our office and we'd be more than happy to set them up for testing and a consult. So now that it's over, Dr. Mitchell, thank you so much. We appreciate it. And you guys feel free to contact our office. Okay. I hope everybody has a great night.
Thank you, everyone.